All right, welcome back to the Elias Macko Show. We're going to talk about healthcare in just a moment and a couple of really serious points about our healthcare system. Before I get there, listen, I've been flooded by notes from you listening right now on the state of our road system, just how bad it is, everything that you're going through right now. I'm reading all those notes. We will have to hold some people accountable sooner than later on this show. Can I just bring up one other thing since I'm on a roll on just the dilapidated state of our roads and our road structures? Another thing that we need to talk about is not just the potholes, although the potholes should be number one on the list. Can we also talk about the graffiti that's on all of our structures, like the Turcotte? And I'm going to bring one up because I had a good chuckle. There's now a new graffiti that's popped up on the Turcotte interchange. I mean, there's a new one every day, it seems. It's absolutely covered. No one does anything about it. But I had to laugh at there's this one, and now you're all going to see it as you drive through the Turcotte today. It's huge, okay? I think like font size, it's like the biggest one that you see when you go through the structure. And I had to laugh because it's MAKOS and then three other letters. It's not a word. It's MAKOS and three other letters. That's the guy's tag. And I'm like, you know what? You know what would be brilliant? I need to pay like graffiti artists out of pocket to just go and graffiti a billboard for the show. They would get away with it. It would never be cleaned. It'd be basically like a free billboard. And I'm sure these graffiti artists, that's all they want to do is tag. So you know what? If there's a graffiti artist listening, and if you want to adopt as your tag, Elias Macko Show, CJAD, make that your tag, folks, because this Quebec government and Transport Quebec, they simply don't care. And they love looking at all of our transport structures get more dilapidated and covered in graffiti and grime. They do nothing about it. But while you're driving on the Turcotte, be on the lookout for the tag. That is the first 5 letters is my first name. I love that. Little bit of subversive advertising for the show. All right, let's get to our next guest. We're going to go over to Emmanuelle Faubert from the Montreal Economic Institute. That institute has a pair of news items out in the last little while. One asking Canadians about how much they want private healthcare, private delivery of healthcare, I should say. And then another about how outdated the technology in our healthcare system is. Let's welcome Emmanuelle onto the program. Welcome back.
Good morning.
So let's tackle this bit by bit here. And we talked about it on the show last week with one of our panels in the morning. The growing appetite of Canadians for private care, but I believe we're talking about private delivery of care more than anything. Maybe you can put that together. What are Canadians telling you here in this poll that you did?
Essentially, what Canadians are telling us is that they don't care about who delivers the care as long as they get care. Because at this point, wait times and waiting lists are not a bug; they're a feature of our current healthcare system. So that's why Canadians are increasingly aware of what's happening in other countries and wants the same for us.
So what do they want?
Well, according to our poll, 56% of Canadians wish to have access to independent healthcare providers. And so that shows that we really are done waiting. We've been patient enough, and we need to rethink the way we control our healthcare system and prioritize access beyond anything.
What do you think's standing in the way of us rethinking, reimagining how we deliver healthcare in this country?
Well, there's a lot of misconceptions about the role that the private sector does and should have in our healthcare system. The thing is that right now, that's been historically, especially since the publicization, the dismantlement of the private sector, in the sense of historically a lot of it was delivered by religious organizations and non-for-profit, and when it came in under the public system, the incentive structure changed, and Canadians agree that enough is enough, and we need to reduce our wait times. And if we need private providers, sure, let's get it, because needs for healthcare services grow, and they will continue growing, and that we need to stop stagnating and improve things to make sure that Canadians get access.
Emmanuelle, why don't you respond to a listener here who sends me this text message? And they write this: private healthcare does not lead to better services for the general population. The U.S. spends 20% of GDP compared to Canada, 13%. The U.S. spends more for worse health outcomes, lower life expectancy, higher curable disease mortality rates, et cetera, et cetera, et cetera. This listener says they look at the States, they see tons of private healthcare. It's not a good thing. What do you say to that?
Well, first of all, we're not trying to look at what the United States are doing. We're looking at other countries in Europe that have universal healthcare systems, just like us, but they have much better outcomes. And what we see is in all those countries that have the best healthcare systems in the world, they have a high universal, like we do, but their focus is on being hybrid. And that's hybridization, that's collaboration between public and private, is part of what makes it more efficient and what we lack here in Canada.
Are they paying more out of pocket in those European nations? Because I think you're absolutely right that we need to not think about the United States. We need to think about other single-payer systems. But in those other single-payer systems that are definitely more successful than Quebec, than Canada, are there higher out-of-pocket costs?
It depends really, because some of them have co-payments. They are structured differently, but they do have a more efficient system. And the thing is that we pay indirectly through our taxes, through everything. We spend a lot per capita. Canada is one of the countries that spends the most on healthcare. And it's just that the money, it's not sufficient to just spend more money. We need to rethink the structure of how that money is spent, and having less administration. Canadians agree that our system is too bureaucratic. 76% of Canadians actually agree with that, and it's too centralized. 2 out of 3 Canadians agree with that. It's a question of organization rather than trying to maintain control and creating a beast like Santé Québec, where the bureaucratic machine grows so much then that you have to pay to just manage that humongous structure.
And I think it speaks volumes that here in Quebec, we see the issues of their healthcare system, and we are the most out of all Canadians in favor of more private delivery of services here. I want to talk about one other thing with you, Emmanuelle, while we have you on. Emmanuelle Faubert is with us from the Montreal Economic Institute. I want to talk about a medical innovation, the technology that our healthcare system is using. And you're saying that Canada, Quebec, we are falling behind in medical innovation. We're using outdated technology. Tell us more.
So the thing is that Canada is great when it comes to research. We have great brains and great researchers that develop a lot of innovation. The issue is not there. The issue is when it comes to adopting those technologies and deploying them. If we look, example, at the robotic-assisted surgery, so these are robotic systems that help surgeons improve their precision, and then they decrease the risk of hemorrhaging. They reduce the time that a hospitalization time. They reduce the risk of complication and readmission. But when you look at how many are deployed, Canada is lagging behind. For example, Da Vinci robotic system, which is the most common installed around the world, we have only 39 centers in Canada that have them. In the United States, we're talking about 2,000 centers with over 5,500 systems. And even in Germany, another universal healthcare system, they have over 200 systems in use. And most of our systems in Canada, in the 39 centers, are provided through philanthropy, not through the general public.
Wow.
Financing.
So it's not even coming through our taxes. It's other people saying, hey,
no.
we're so backwards, we're so behind. It's philanthropy saying we'll foot the bill to get us up to the same level as other countries.
Exactly. And this is not just it. We're talking about another innovation, proton beam therapy, which is a type of radiology which is used to treat persistent tumors for which patients don't really have a substitute. Canada is the only G7 country without an open center to treat patients.
Wow.
And compared to that, the U.S. have 40, and what we're obligated to do is we have to send patients across the border in order to treat those patients. And just to give you an idea of how late we are, the first version of this technology, so let's say the grandfather of the current one, was first used in 1954. So we are really behind.
Jeez. I don't know if you've seen that stat that said that Pittsburgh, Pennsylvania, just the city of Pittsburgh had more MRIs than all of Canada at one point. Well, MRI machines, right? I don't know the current statistics on that front, but it just shows you, like, the MRI, like, we don't have enough of just that base. That's a basic technology. That's not like the latest and greatest newfangled thing. But there are so many things where when it comes to equipment and technology, it seems like this country is falling behind. What do we do?
Definitely.
What do we do, Emmanuelle?
So that's why we need to change the incentive structure. Right now, the incentive structure is very centralized, and it leads to, when it comes to decision making, there's a lot of risk aversion, and that means that the fear of decision makers, whether that is at the highest spheres of the public system, at the government level, or even at the hospital administration, there is very little incentives to adopt technologies because it is costly. And the costs are very concentrated, the risks are very concentrated, but the benefits are so spread out throughout patients over the years. So we need to ensure that the incentive structure allows the will to adopt these technologies.
Emmanuelle, going to have to leave it there. Thanks for coming on today.
Thank you for having me.
That's Emmanuelle Faubert from the Montreal Economic Institute.
The newest tracks. Let's go. New music. And the next big thing.
Always on the new music first.
Your first place to hear it all.
'Cause you gon' like it, love it, wanna play it twice. Playing now.
iHeart New Music. Your digital station for brand new drops, fresh finds, and tomorrow's bangers.
I think we need something new.
Discover iHeart New Music. Always fresh, always first. Stream now on the free iHeartRadio app.